Thank you, Stan. All right, so we're going to switch now today to do a panel focusing on social justice and health equity. This is social justice and health equity is something that has been central to what we do at the School of Public Health for quite some time. I think most of our faculty have at least some focus in health equity, and then particularly, I think our department in social behavioral sciences has made this a premier focus. I would say probably starting in the last 10 years, where we kind of started to transition from a department that focused on kind of health behavior from often the individualistic level to moving more and more along the larger social determinants of health and what we call the higher levels of the ecological model, looking at social structural factors of health. And from that, we started bringing in expertise that you see on this panel, with expertise in things like housing and stigma and racism and discrimination and poverty. And so as we move more and more to that focus, it became kind of the central thing that our department does and that our school does. A major theme that kind of goes with the work that we do is not only to improve health, but to improve health in a way that is both just and equitable. And so, and with that, we started, matching kind of what we do in a research level with what we do from both a training and an educational level. 5 years ago, we started and developed one of our core courses when we redid our core curriculum, which is a course that Danya Keene now teaches on social justice. It was one, I would say, relatively early in terms of public health schools that adopted a focus on social justice as a core part of their curriculum. And then we started after that with really impetus and direction both from students and the community on doing a concentration in U.S. health justice that Danya also heads, that we will probably talk about both directly and indirectly over the course of the workshop. So it is my pleasure. We put together this panel that kind of represents, I think, some of the interests, although I think our interests are we have even more interests and expertise within the school and within our department. But I will start and introduce our illustrious panel. So first, let me introduce Danya Keene. Danya is an associate professor of social behavioral sciences at YSPH. Her research examines housing and housing policy as determinants of population health equity. She kind of moves looking on just housing as an individual health determinant, and really looks to see how ongoing histories of housing discriminatory policies constrain housing access and contribute to health inequities. So welcome, Danya. Next, I'd like to introduce one of our newer faculty members just joining this year. Dr. Ojoma Apara is an assistant professor in the Social Behavioral Sciences Department and director of the Substance Abuse and Sexual Health SASH Lab. Dr. Apara's research focuses on strengths-based approaches to substance use and HIV prevention, and also utilizing racial and gender-specific strategies in prevention and promotion for Black girls. And so welcome, Ojoma. Thank you. All right, next, I'd like to introduce Kathleen Duffany. Dr. Duffany is an associate research scientist in public health and social behavioral science department and director of research evaluation and community alliance for the research of engagement, also known as CARE, which is a collaboration with Southern Connecticut University as well. Dr. Duffany's research examines the social, biological, behavioral, and structural barriers to health equity. Over the past 2 decades, her work includes extensive interactions with schools and community-based organizations to prove health and educational outcomes, and is really engaged within and at the community level. And so welcome, Kathleen. And our final panelist is Dr. Katie Wang, who's an assistant professor of public health, also in the social behavioral sciences department. We have a big contingency here from SBS. Dr. Wang's research broadly focuses on the role of stigma as a psychosocial determinant of mental and behavioral health disparities among a diverse marginalized populations, including individuals with mental health issues, drug users, and individuals with disabilities. So welcome, Katie. All right, so thank you for joining us and taking your time on this panel. So I want to start off with just giving us, I gave everybody a little blurb of what you do, but that didn't really do it justice. So I just kind of want to start off with describing, each of you kind of going across and describing the work that you do, your research kind of in just in a broad sense, and maybe give a specific project you're currently working on to ground it a little bit. So not only the broad description, but maybe kind of one of the projects you're currently working on, just so we have kind of a taste of the breadth that you all are doing. So Danya, do you want to start?
Sure. Hi, everyone. Thank you for coming. Yeah, so I can tell you a little bit about what my work in my lab, the Housing and Health Equity Lab at YSPH, is currently working on. Trace already mentioned that I'm focused on understanding how housing and housing policy affect health and health equity. And I would say our current projects are really focused on understanding the health implications of this severe affordable rental crisis that we're experiencing in this country right now. You may have heard that there's no state in the U.S. where a full-time minimum wage job is enough to affordably rent a one-bedroom apartment, and that lack of housing really has significant health implications, including what we saw during the pandemic with COVID. So I guess one project that we're working on to look at this, how this lack of access to affordable housing affects health, is that we have a 5-year mixed method study that is looking at the relationship between affordable housing access and type 2 diabetes management and control. And we're doing this by using nationally representative data to compare individuals who are receiving subsidized housing resources with those individuals who are on these incredibly long waiting lists for this resource. Like New Haven has 10,000 people on the waiting list right now for subsidized housing. So we're also following a local cohort of individuals who are waiting for housing and looking at their health as they move through the waiting process and hopefully into housing. Another thing we're doing is looking at the current eviction crisis and the impacts of that on health equity. We're also tracking some of the policies that are intended to mitigate that crisis.
Excellent, thank you. Joma, you want to go next?
Sure. Thank you all for having me and thank you for coming. So excited. So to talk a little bit about my work, I focus on youth substance use prevention and HIV prevention, specifically in urban communities. I do this through community-based participatory research methods. And the community that I focus a lot of my attention on is Paterson, New Jersey. I'm born and raised in New Jersey. I have close ties to New Jersey. So New Jersey will always be my home. And I do a lot of my work primarily there, mainly because Paterson, New Jersey kind of reflects the population that I care most about, which are, urban ethnic minority youth, specifically Black and Hispanic youth. So with that work that I'm doing, just to give you an example of a project that I'm working on, I received funding to do a 5-year community-based study, specifically looking at substance use prevalence rates in the city of Paterson, and then also mental health prevalence rates in the city of Paterson, but then analyzing that by neighborhood and seeing how neighborhoods within Paterson can predict, can predict and have associations with low or high drug use, low or poor mental health symptoms and so forth, so that we could be able to develop a community specific, racial and gender specific substance use and mental health prevention intervention for the city of Paterson. And what that kind of may look like is that may be multiple interventions depending on the area of Paterson, depending on what my survey data and qualitative data study shows up, whatever the findings show up, because for those of you who may not know, Paterson is a very diverse, community. Some parts of Paterson are thriving, while other parts of Paterson aren't. So looking at it through this strength-based lens that I focus heavily on is that I want to be able to learn what are some things that are happening in Paterson that are actually pretty useful and that are actually protecting youth from using and abusing substances and protecting youth from having poor mental health symptoms, and how can we duplicate those strategies and those methods in other parts of the area. And then another line of work that I focus on is strength-based approaches and highlighting strengths of Black girls in prevention work too. And I'm currently leading a project called the Dreaming Girls Project. And this project is going to be adapting an HIV substance use prevention intervention specifically for Black girls. But this project is going to be designed by Black girls for Black girls. So we're in the process of doing data collection and interviewing Black girls to kind of see what they want to see in a program like this, but then also getting their perspective on what do they think are protective factors that they need to reduce, their chances of abusing or using drugs. And then also seeing the connection between gendered racism and how that impacts how they view themselves and how the world views them and how that may impact their behavior. So those are the two major projects that I'm working on within my lab. And I do other projects. Those are the main ones that I'll talk about now. But if you have any questions, I'm more than happy to answer them later.
Can I just ask a follow-up on that?
Sure.
So you said you're looking specifically on the second project on gendered racism. Can you explain that? Because not everybody might know that.
Yes.
Yeah.
Yes, sure. So when I talk about gendered racism, I talk about the fact that when we talk about racism, we're often looking at, when we think about racism, we think about, discrimination against race, for example. But then I talk about how Black girls specifically, their injustices, the racism that they face is often different than what Black men or Black boys may face. And the sexism that they experience is also different from white women or from other, from other female or ethnic minority groups and so forth. So the discrimination that they face is very unique to Black girls, and it's often experienced even within groups. So Black boys, for example, can have these gendered racist stereotypes against Black girls. White women or white girls, for example, can treat Black girls or view Black girls through a gendered racist lens. So I focus specifically on that work as opposed to racism and and sexism. Because when we think about intersectionality, if anyone most of you may know about intersectionality, but we think about how Black girls belong to different social, different identities that are often marginalized and oppressed. They have race, gender, sometimes class, religion, and so forth, and that all impacts how they view themselves and how the world views them uniquely. So I talk a lot about that in my work and how that impacts certain behaviors and health outcomes related to substance use and HIV and STI prevention and so forth.
Awesome, thank you.
Welcome.
All right, so Kathleen, you want to go next?
Hi, everyone. Good to be here today. So as Trace mentioned, I work very much, and Sten mentioned also, that I work in the community in New Haven. So I do community-based work, programming, evaluations, research to reduce health disparities in chronic disease in New Haven, which we mainly see in specific neighborhoods in New Haven and among Black and Brown communities here in New Haven. So I work with residents in New Haven as well as New Haven organizations to identify the health disparities through needs assessments that we conduct with them, through barrier and facilitator analysis that we conduct with them, to identify the critical health issues. And then we co-design programs and evaluations with a goal of ultimately informing policy. So policy, small p, but also policy eventually, the capital P policy, to have this sustained impact. My topics are broad. Right now I'm focusing, and broad because the community, it comes from the community and looking at the disparities in the community and with the community and what they want, what is really important for them to focus on. So mainly my focus right now and for quite a few years has been on food security here in New Haven, also social determinants of health, and then multiple initiatives across the nutrition landscape. So with food security, it came out of our focus on it, my focus on it came out of the needs assessment, the community-based needs health assessment done by the hospital that's required on a regular basis. And it's a very large issue and one that our community wanted to address. So working with food pantries has been part of our work. Asking residents, what are the barriers, what are the facilitators, what are the needs, and working with the residents as well as the pantries to make the pantry system more accessible so that it can be utilized without all these policies that were in place that were keeping people from accessing them in the first place. Also addressing issues around healthy foods in pantries. So we're implementing programs around and evaluating them around healthy nutrition standards. So we're implementing SWAP across pantries in New Haven. Also, bringing community health workers into pantries to address social determinants of health. So other social determinants of the health, as well as linking people to jobs and linking people to clinical care from where they're at in the food pantry, coming to the food pantry. And then also taking it a little bit higher as we talk about the socio-ecological framework that we're working across it to really think about the policies that impact the pantries and working with the city on, for example, we're working on the city for evaluating their citywide plan and policies on urban agriculture in New Haven and to address food justice in New Haven. So ensuring that we're working across the spectrum within a particular topic area. So that's an example of some of our work in food security in New Haven. And it's really addressing issues with evidence-based practices and research that is also then adapted and modified by the community and for the community. So food security being one topic, we're also doing a lot of work in our center addressing disparities in breastfeeding here in New Haven. So we have facilitated and are closely working with a New Haven Breastfeeding Task Force that has grown out of the Food Policy Council here in New Haven. And this task force, again, is addressing breastfeeding supports at the individual level, thinking about, are women receiving peer counseling, lactation support from somebody who looks like them, and making sure resources are there to employ peer counselors that look like them. And we've been able to do this all the way up through policy changes, things like we're thinking about bias training for physicians. We've developed a training for healthcare providers around addressing bias in care and support for breastfeeding, specifically for Black moms. Also looking at the policy level around breastfeeding friendly businesses, breastfeeding friendly pediatricians' offices, which affect a woman's ability and continuation of breastfeeding. And then also like breastfeeding locations in New Haven. So we were instrumental in getting a room set up for breastfeeding at Union Station here in New Haven. And we're looking to do many more this year. So we had a little halt because of COVID as far as that initiative, but we've made some great progress with getting breastfeeding friendly locations as well. So working with moms on the task force as well as community organizations to address the support for breastfeeding, to address disparities that we see so evident in New Haven for Black moms as well as Latina moms. And we're doing work in that area as well. So just giving you a sense of some of the food related work that we're doing. And I think a little bit later, we'll talk a little bit more about how we do it in our programming.
Awesome. Thank you, Kathleen. And last, Katie.
Hi, so it's great to be here. Thank you so much for having me. As Trace mentioned earlier, my research focuses on stigma as a social determinant of health disparities. And I have looked at this across a number of different marginalized populations. So I think now I will highlight two key projects I'm currently working on. So one of the studies I've been working on in my lab is looking at mental illness stigma as a risk factor for substance use among adults with depression. So it is a 5-year mixed method study. We are specifically looking at how stigma might drive substance use behaviors among people who are diagnosed with depression. and also what mechanisms might link stigma to substance use behaviors. So one thing that kind of motivated me to start this study was that when I review the literature on mental disorders and substance use disorders, I see a very high rate of co-occurrence. People with mental disorders are significantly more likely to develop alcohol and drug use problems. However, while there has been a lot of attention looking at biological and psychosocial factors driving that co-occurrence, stigma has not been discussed very much in the literature. And I do think that's an important gap because stigma can potentially interfere with help seeking among people with mental health concerns. It can potentially deplete people's self-regulation resources. And by that, I mean, when people spend a lot of energy coping with stigma and trying to figure out how to combat stigma, they might have less resources to regulate their behaviors. They might be more inclined to seek out coping strategies such as using alcohol and drugs. And I think those are important processes for us to look at in empirical research. So in this study, I am in the process of recruiting participants with depression. I use daily diaries to track people's substance use behaviors and stigma experiences over a 2-week period to see how those things might be related with one another. I also have a component where I bring participants into the lab and look at how their bodies respond to acute stress and how that response might vary as a function of their chronic exposure to stigma and how that stress response might predict their substance use behaviors. So we are about halfway through our recruitment goal right now, and I still have another 2 to 3 years left on the project. So another study I've been working on in my lab looks at the experiences of the COVID-19 pandemic for people with disabilities. So that project is motivated a lot by my own personal experience. I am blind, so I identify as part of the disability community. And since the start of the pandemic, I've been hearing a lot of stories about the challenges people with disabilities have been facing as a result of social distancing measures, as a result of a lot of essential services not being available, especially at the start of the pandemic. So I applied and was very fortunate to receive pilot funding from the Yale School of Public Health. And I conducted a survey last fall looking at the experiences of the pandemic and the impact of the pandemic on the mental health of adults with disabilities around the United States. We recruited around 450 participants with disabilities. And what we have seen so far in our data is that disability-related stigma and social isolation are 2 of the key predictors of increased depression and anxiety symptoms among our participants since the start of the pandemic. Right now, I am just in the process of collecting a second wave of data. So the first survey was done last October. So we are about 1 year out since the first wave of data collection. So I am now collecting follow-up data to see how our participants are doing and how their mental health has shifted over the year and how they might have been encountering different challenges, with vaccine access and whether they are able to access the vaccines in an equitable way, and how people with disabilities have been adjusting to, this gradual shift back to normalcy as we continue to navigate this pandemic. So that's kind of what I'm looking at right now. And I think, moving forward, I would definitely like to incorporate more intersectionality into my research, looking at how Black and Latinx people with disabilities, for example, have been navigating stigma and navigating the intertwining experiences of racism and ableism in the context of the pandemic, but also beyond that. So I can talk more about that later in the panel.
Thank you so much, Katie, and thank you. I mean, so as you can see, I think this is a great example of some of the amazing innovative work in this space that is going on here at the School of Public Health. And so thank you all for that. And before I ask my next question, there's actually a question from the audience. Ruth Tabor asks, Danya, Do your housing projects concern only those in need, financially lack, etc.? And how is this reflected in public health? Or how about the difficulty of elders, any income level, living in their homes that were not designed for older people? Do you have you worked at all with the architectural school? And what about housing with the village concept starting by a group at Harvard years ago and popping up in assorted states, or the greenhouse concept for assisted living?
Sure. Thank you for the question. Yeah, I mean, my research is really primarily focused on housing access. And so, inequities in housing access, and less so on the side of housing design, although I find that personally very, very interesting. Um, so, mostly focused on issues of income and how that constrains housing. But I have done some work that kind of gets at the experience of older adults in their homes. We did a study about reverse mortgage loans and the challenges that older homeowners can face in maintaining their homes, which are usually related to financial challenges, but but sometimes relate to the structure of the home and how it may not meet their needs. And we are doing some things with the School of Architecture. There's actually a workshop planned for it's an executive education workshop planned in the spring that I'll be participating in on a panel with faculty at the School of Architecture, that Elihu Rubin, we're doing that together. So I hope that we can have more partnerships with the School of Architecture.
Yeah, we've had 3 of our MPH students in various projects work with the School of Architecture. There are people there that are doing work specifically on inclusive design, the idea of creating spaces that are inclusive based on a variety of identities. And so we've had 3 students do their theses, all related to that aspect. One on creating inclusive designs around LGBT issues, one on creating inclusive designs in terms of art museums and how they could be inclusive and answer issues related to COVID. And then one in creating inclusive designs in mental and substance use treatment facilities. So we have been doing some stuff about actual like space in housing, but not as much as like what Don is doing in housing access. So, all right. So thank you for that question. Keep them coming. So next question I want to ask is, we've talked about social justice, in kind of the description and the focus of this panel, and it's a term that's becoming more and more central to the kind of the work that public health does. So can each of you talk a little bit about how you integrate a social justice perspective from your research? And Katie, since we went last with you last time, can we go first with you this time?
Sure. So as a stigma researcher, I think, social justice is central to what I do as a researcher. The goal of my program of research is essentially to improve the life of marginalized populations and to make sure that we understand and address the role of stigma as a barrier to health equity for these populations. One thing that I touched on towards the end of my introduction is that I have become increasingly interested in intersectionality. And I think that addressing intersectionality can be a great way to further incorporate social justice into my program of research. So one thing that I've noticed while doing work in stigma is that there tends to be an emphasis on single axis of oppression, right? So people who are interested in racism are often focused mostly on racism. People who are interested in sexism mostly, focus strictly on gender. So there's not a lot of attention looking at how these two, different marginalized identities can intersect, which is unfortunate because our identities do not exist in a vacuum, and all of us we exist at the intersection of multiple identities, and we are oftentimes marginalized in different ways depending on how our identities combine. We might have certain privileges and certain sources of oppression that are distinct from other individuals. So I think, going forward, I would definitely like to incorporate more research on intersectionality into my work. And I would like to do this in several different ways. One way is to look at how things like race and sexual orientation might intersect with disability. So that, I can bring together the existing research on ableism and racism, or ableism and homophobia, and look at how these different things might play together for multiply marginalized members of the disability community who so far have received very little empirical attention, and we don't really understand their experiences of their intersecting marginalized identities very well. Another way I would like to incorporate intersectionality into my work is also to look at the intersection between mental health and substance use stigma. So as I mentioned earlier, I am currently doing a 5-year study on how mental illness stigma impacts people with depression. But of course, substance use disorder is also highly stigmatized in a lot of contexts. It might even be more stigmatized compared to a lot of the mental disorders. So I think going forward, I would like to look at how mental health stigma and substance use stigma intersect, and how that intersection could potentially exacerbate the health outcomes of people with co-occurring mental health and substance use concerns.
Awesome, thank you. Najoma, do you want to go next?
Sorry, I was looking for my mute button. Yeah, sure. So within my work, I integrate social justice in 2 ways. So just as a community-based participatory researcher and as a substance use prevention researcher, I mean, substance use prevention work has been done for decades, like it's not new, but we see that just as my work in urban communities, we see that substance use is still an issue, especially with youth that live in neighborhoods where substance use is often normalized. They often have high access to drugs because of racial segregation and having an influx of drugs within their neighborhoods, and that in itself is an environmental justice issue. And then they also don't have access to like proper education or proper substance use prevention resources that could help them to cope in other ways as opposed to using drugs. So in my approach, I think that social justice within the public health lens should be focusing on health equity. And if we do that, we can't have a one-size-fits-all approach. And I think that often is what happens in prevention work, is that we create an intervention and assume that every youth in the entire country should be able to not only use this intervention, but it should be successful. And then if it's not successful, we're often blaming them as the individual instead of us as researchers thinking, what are we missing? Are we missing something? What was it about the way that we conducted our studies, the way that we designed this intervention that didn't connect with this specific group? So with my 5-year study that focuses on neighborhoods and its impact on substance use and mental health, one of the things that I found as a researcher in Patterson was that when we do substance use work, we often are doing it with youth in schools. We collect data from youth in schools. We do interventions with youth in schools. It's easier to get a large sample of youth in schools because most youth are in school predominantly most of the time. So it's just easier to be able to get a large sample. Even national studies do it this way. But what I realized was that cities like Patterson had a high truancy rate. So they had youth that weren't attending school, often for multiple reasons, for mental health reasons, for reasons dealing with being not feeling comfortable coming to school because of their neighborhood crime, bullying, just a whole bunch of different reasons. And what I found out was that we don't know much about those youth. We don't know much about why they are or aren't using drugs. We don't know what risk factors or protective factors may be in their lives. So we're creating interventions that aren't really catered to them. And they may be, just from what we know about education research, they are often the group that is most at risk of abusing substances and having poor mental health outcomes, which could be the reason why they're not going to school and so forth. So with my work, what I'm doing is this innovative approach called venue-based sampling, where me and my research team is going out into the community and identifying, I have to be clear, going into the community and identifying venues where youth that aren't typically going to school and now where youth typically hang out at. So actually going to where they are, like literally meeting youth where they are, asking them about, drug use prevalence rates and so forth, having them fill out a survey, recruiting them to be a part of our qualitative studies, and then also providing resources right then and there to them. So we're doing this approach as a way to be able to see if we can learn from them and figure out what is it about them that may be causing them to use or not use drugs and so forth, so that we'd be able to include them in intervention development work. So that's one way where I integrate social justice work. It's harder. It's not, a traditional way to do substance use prevention work or even collecting prevalence data. But I think my job as a researcher is to be able to figure out, how do I meet youth that are often considered hard to reach or at risk? I think that as a researcher, we shouldn't say things like hard to reach populations. It's our job to figure out how to reach them. And if that means going directly to where they are, we have to be able to do that. So that's kind of how I integrate it in my work. And then also too, in my work with Black girls, I focus, and again, it's not this one size fits all approach. It's often done with Black girls, where we assume that intervention that addresses either all Black youth or intervention that addresses girls is just going to be able to help Black girls. But Black girls' experiences are unique in America, besides the fact that they are often discriminated, looking through this gendered racist lens and so forth. Their experiences are unique. And in order to be able to create programs specifically for them, we have to actually go to them and ask them, what is it that they need in order to have a safe or a successful prevention intervention that could support them? What are the resources that they need? And just from my work, what I've found is that with Black girls, for example, protective factors like ethnic identity, gender identity, feeling empowered and being supported were enough to help girls reduce their chances of using substances, reduce their chances of engaging in sexual risk behaviors. So my goal as a researcher is to create programs specifically including those variables, and then also incorporating their voices and their ideas and suggestions in prevention programming work, so that whatever we're doing is going to be for them, by them, and is going to increase their chances of actually using it and feeling supported in using these resources.
Awesome, thank you. Tanya, you want to go next?
Sure. Yeah, so how does my research consider justice and equity? Well, I think one thing is it's my whole research agenda on housing is really motivated by addressing and understanding the impacts of this unmet need for housing in this country. That we have as I mentioned before, we've basically normalized homelessness. We have this huge unmet need, and the other thing about it is it's really not equal. Particularly along lines of race, but also gender. So structural racism has constrained housing access, particularly for Black Americans, through an ongoing history of discriminatory practices. And our government has also supported housing for white Americans, and white Americans have profited from racially discriminatory housing policy throughout history. So in this way, all of this work is really thinking about housing as a mechanism through which racial inequalities in population health are produced and reproduced. And on the flip side, we see, relatedly, we see housing as a really important domain through which we can advance racial health equity. So that's, I think, one of the primary ways that we're focused on justice. And another way I think is just really thinking about how the research drives action. So, I'm interested not only in how improving housing can affect health, but also in the ways that how increasing our understanding of the health impacts of housing policies can motivate action towards more housing equity. We know that health is a really powerful narrative and to support social policies. There's even political science research that's shown that when you take an issue like housing and frame it in a health lens, that there's more support for it. So part of that is thinking about, how do we support action and how do we support the work of people who are doing the action by helping them, get the research and evidence that they need.
Awesome. And then Kathleen, if I could switch to a related question, but slightly different, is a social justice perspective can influence not only the focus of the research that we do, but also how we do it. And so can you talk a little bit about how a social justice perspective influences the way you conduct your work or the way you conduct your research?
Sure. So social justice is really at the core of what we do at our center. And one thing that I think is critical in that is in all our work, really engaging, not just engaging community, but knowing that the community are also the experts, and they have this expertise that they're bringing to the table. And we're co-designing this with the community as expert, and working with the community at every stage of the process. So if we think about the research process, engaging the community before the grant is written, and engaging key people in the community who are doing this work already. So making sure that we're working with partners in the field in New Haven, with community organizations, with residents who have been deeply involved in these areas for a long time and know better than us about what's going to work in New Haven. So engaging those residents early on, grant making, all the way through the process of designing surveys, of looking at data. We have teams of residents who look at data with us, and we say, does this resonate with you? And in dissemination, get the results to your community partners first. That's our priority. And really respecting that, and respecting the community as experts. In this regard, we actually have a program in which we developed a program when we match community residents who are interested in a particular area, who have a deep lived experience, knowledge, passion in a particular health area, and with research teams at Yale, with investigators here at Yale Medicine, and the hospital, Yale School of Public Health. I have them on my teams. And it's an 8-month program. It's an 8-month fellowship program for community residents, so that community residents have the confidence and the public health language to sit at that table, and for the investigators to see them as the experts that they are and what they bring to a research study. So we've partnered the residents with the investigators, and it's an 8-month fellowship. Residents get paid, and we also have monthly meetings around public health. We talk about, they get certified with the IRB. We talk about ethical issues. We talk about grant development. We work on the surveys. What does it look like? What are the ways to develop a survey, things to consider. So we look at methods, we look at ethics, and the way they are now leaving the program, and we say graduating, we have a graduation, people are going on almost like a workforce pipeline, where people who are going through this program are joining research teams, have been hired as RAs here at Yale, have been hired as consultants to continue on projects that they started on through their fellowship, have gone on to be CHWs, getting their bachelor's. So really engaging community residents, but also engaging the investigators to be doing these community-based approaches, and working with investigators to engage community authentically on their research teams. So we are, I have a community research fellow on each of my research projects, and they are an integral member of the team. And that means also being flexible, say, about your scheduling of meetings. So how do we bring social justice to everything we're doing also is about how we're operating as a team. So it's, community first, and the community as experts, and then also, not just what we're studying, but how we're doing our work. So we are looking across our operations as a center, and really trying to address equity, racial equity within our work itself. So within our operations, with our hiring operations, with our staff training, with our research and evaluation protocols. So looking at these operations within our center and how we're doing our work, and making sure that that we're walking, we're walking the talk, that we're not just we're not just researching equity, but actually we're doing it in our daily lives. And so, you know, really having an opportunity for the team to work on the internal work, to work as a group, as a center to ensure equity, and then equity in our programming also. So we actually received a grant recently, actually it just went live October 1st, to look at equity in programming of fruit and veg incentive programs, so fruit and vegetable prescription programs. And while we're looking at, you know, do we see reduction in A1C when we do very cost-effective fruit and vegetable prescription programs? Do we see reduction in A1C? We're in this particular grant, we have a grant for that, but in this particular grant, partnered with that grant, we're looking at, is the program being conducted in an equitable way that people that live up to Fed principles of fidelity, equity, and dignity for the people who are participating. So the people are participating, we want to hear from them first before we implement the program. We want to know, how do you want the program implemented? How do you want to receive the vouchers? Who do you want to receive the vouchers from? Where do you want to be able to spend your voucher? So not taking our model and imposing it, but asking the community how they want the program developed and learning from that. And then that though is for that community. So very much like it's for that community, and it's the process then that can be replicated. So we received a grant to develop this process that can then be replicated. So we'll be actually doing it with pregnant moms in Hartford. But what we hope to come out of it is a program in Hartford, but also we're looking at the process that we're using so that the process can then be replicated elsewhere. And then that means, like Ijeoma said earlier, it's not about, you know, one size fits all. It's going through this process and making sure that this program fits for this community and is driven by this community. I think I'll stop there.
Awesome, thank you, Kathleen. And you know, in terms of the community fellows, I have had several community fellows. We hired one as one of our project coordinators after they finished the fellowship, and another stayed with us even after they finished as well. And they're just central members of our team. Does anybody else want to answer that question, Ijeoma, in terms of how you kind of conduct research with a social justice lens? Anything to add? If not, we can move on.
Yeah. You know, Kathleen said, you know, a majority of what I practice just as a community-based researcher too. I think process is very important. And even in the work that I do in New Jersey, you know, my goal as a researcher and prevention researcher specifically is to not have to do the work anymore. You know, I want to be able to be in this community and provide sustainable solutions with the community, for the community, and then have my job be done. You know, have substance use rates be low, mental health, rates are great. They have the resources, they have the access, they have the programs, and then be able to use the same strategy that I worked on in another community, like New Haven, for example, is a community that I definitely have my eye on, and I've been also getting a lot of connections already with talking about youth substance use and being able to bring my work to New Haven. So I think that, as our jobs as prevention researchers and in the community is so that we don't want to have to keep doing this forever, right? Because then what is the benefit for the community? It's important for us to be able to provide sustainable solutions for and with the community. So not just with our lens, but also having them come in as, as experts of their lived experiences. Even as a Black woman, I tell girls that I work with, like, I'm not an expert on being a Black girl in 2021. You are. I'm not even an expert on being a Black girl in the city of Patterson or, whatever community I'm working in. You are. So I want to hear from you and hear your thoughts, because I don't want to impose my beliefs and my, and my opinions on you and then create a program that's not sustainable, that you don't care about. So I have nothing. I don't have much to add. After I think Kathleen did a fantastic job on that.
All right, so let me see, we have a question from Carrie McDermott. It seems that race, ethnicity, and language data are key inputs to assessing health equity. Could you please comment on your experiences with race, ethnicity, and language data and changes that might improve its collection and usability? Does anybody want to tackle that question?
I could tackle it a little bit. It's a great question. It's a question that often I even ask myself as a researcher when we're collecting data. The usual standard way is, saying, okay, are you Black, are you white, are you Hispanic or non-Hispanic or so forth. But then a lot, and these are questions that, this is what I actually forgot to add. I think it's important within, projects to have, like, especially community-based projects, to have an advisory board of members in the community that could actually serve and, in various capacities, reviewing the study design, reviewing the questions and so forth. And even with the work that I do in Patterson, we have a youth advisory board and a community advisory board. And one of the things that they often bring up is when we ask questions about race or ethnicity, what about people that identify as biracial, or don't identify as Black, for example, but identify as Hispanic, but presenting as, but present as Black or something, or or Black and white and so forth. Why do we have to be choose a specific race? So in the survey that we're going to be doing, we're going to be collecting both qualitative data on how they identify with their ethnicity, but also being able to allow them to check multiple boxes, because that's just realistic in the world that we're living in. And I think when we look at, and I'm grateful that I could do that because I'm creating my survey, but I know for other people who have to use like federal standardized surveys, it's hard to do that because they only really can choose one. And what we do is that we end up leaving behind a sample and assuming that people within a racial group are all homogeneous, when they're not. I talk a lot about how Black people, as a whole, we're not a monolithic group. We're so different based on our, social location, based on our ethnicity, based on, where we grew up and, and so forth. So it's important to acknowledge those differences, and that's really the the way that we should be doing it through this intersectional lens. Language isn't something that I have tackled, to be honest, but I think it is something, especially since I work in a community that is predominantly Hispanic, predominantly Black, and then also has a large foreign-born sample. So that is something that I probably will be tackling in the near future. And when I say near future, probably like next year, it's going to most likely come up. And I'm going to have to, work with my research team, work with my community partners to figure out how we can incorporate how language may have an impact on how well youth, feel like they fit into the community, and whether that has an impact on whether they even understand or don't understand prevention, resources and so forth. But I think it's a fantastic question, and something that we should all be considering.
And it gets to the point that both Ijoma, you and Katie have raised about the rise or the importance of taking an intersectional lens and looking at these complex overlaps of identities. Although it does, as kind of raised by our questioner, it does raise, like, the more identities we have or more intersections we do, like there are going to be like analytic and measurement implications of kind of how best we could represent somebody's, like, be true to what somebody's stated identity is, but still be able to model it within the context of the tools we have analytically. So it's something that I think is an ongoing challenge in public health.
Mm-hmm. Yeah, absolutely. And I'll even say, even with my dissertation data, my dissertation data was on Black and Hispanic girls. And there was a sample, like a small sample, like maybe 40 girls who identified as biracial. And I didn't really know what to do. And my dissertation chair was just like, okay, just drop them. You can only, and I had to, and I felt bad because I feel like these are stories that we're missing out on, in our data. And I knew that, when, and I'm not saying that I love my dissertation chair. I'm not saying that, he was wrong for advising me that. I'm being recorded. I don't want him to see me, but he's great. But that brings up, your point, Trace, is these analytical issues. How can we compare a small sample of like 40 girls and not just, lumping biracial people all together? Because these are girls that identified as Black and Hispanic, Black and white, Black and Asian, Asian and white. How do we, be able to tell their stories, understand their experiences in this statistically significant type of way? And I think that's something that I'm continuing to work on and learn, and I'm sure most people are as well.
Even that you were talking about, you can see potentially, and we saw it recently in a very small project we were working on with New Haven Farms, or Gather New Haven, here in New Haven. Having that small sample, but seeing this trend, so it wasn't significant. We had very small numbers, but we then talked to the people, and you were saying, gathering that you're looking to do in Patterson, gathering that qualitative piece, and really triangulating that and saying, okay, so not statistical significance, but we have some strength here. There's a story here, and this is something maybe you could look at then in a larger population. But I think that's definitely how we should be looking at it. And even with the small samples, we can learn, I think, by exactly what you said, is looking at this, the qualitative, getting that qualitative piece too. And then moving on to a larger sample if we need to.
I really want to
Awesome,
echo Kathleen's point about qualitative research. So as a psychologist by training, most of my background and most of my research today has focused on quantitative and survey methods. But what I am realizing is that, as others have said, when you study intersectionality and how these two multiple identities come together, it gets very complex, and it's often difficult to tease those identities apart using quantitative measures, both because of small sample size issues, and also because without knowing what the experiences of those individuals are like, it's hard to design survey questions that actually get at those experiences. So I've also started using more and more qualitative interviews and qualitative methods in my research. Even when I do a survey in the context of the COVID and disability project, I ask participants to provide narrative responses about their experiences during the pandemic as part of the questionnaires, so we can conduct qualitative analysis on those written narrative responses. And I do think that really speaks to the strengths of mixed method research, and that's something I would like to definitely do more in the future to better incorporate social justice and intersectionality into my work.
That makes Danya very happy as a qualitative researcher, right, Danya?
Okay.
Go ahead.
I was just gonna say one more thing about intersectionality and sort of the challenges. And we've been, this is something we've been talking a lot about in the class that I'm teaching now, and just what it means when you have so many different possible intersections, and there's so many different categories that people can be in, and how do you think about that? But one thing that we've kind of came to in a conversation is that it's not necessarily about keeping track of all the possible combinations and boxes, but it's about like the approach that allows you to like think about how every person has multiple identities. So what does it mean to like what is having that general approach mean in how we design programs and think about how to meet people where they're at?
Yeah, we're starting to ask like almost all of these types of questions open-ended in our surveys. I mean, which has challenges as well, but it does at least allow people to reflect their identities as they see it in that aspect. So, but all right, so I'm going to switch gears, and it kind of relates to what Danya just said in terms of the class. So, in addition to our research, we are responsible as faculty at School of Public Health and kind of our mission to provide training and mentorship to the next generation of public health researchers and practitioners. And so what are some of the ways that you and YSPH provide skills and experiences that allow students to use principles of social justice and anti-racism in the conduct of the public health that they do? And Danya, do you want to start on that as the teacher of our social justice class and the head of our U.S. health justice concentration?
Well, sure. I'll start by talking about, Trace mentioned that a few years ago, I think it was 2018, we redesigned our core course in SBS. This is a required course of all MPH students. to focus on, to move from a focus on individual behaviors to really thinking about the unequal structures and contexts in which these, behaviors and health outcomes are produced. And I actually think I don't know how novel we are as a school in doing this, but when I was at the CEEF team was here, interviewing us about our accreditation, and the first question that they brought up about the core curriculum was, what's up with this social justice class? We haven't seen this as a core class in a required class in a school of public health. So I think it suggests we're doing something kind of novel. But anyways, the course, it's really designed to get students thinking about how inequality, like power and structure, is shaping the opportunity to be healthy. And there's a focus on racism and anti-racism throughout the course, given that racial inequalities in health are so severe in this country, and racism really drives a lot of, not just the inequality in health, but I think, that health outcomes that we have as a whole country. And the course covers a lot of topics, but the main goal of the course is really to, we can't cover everything, which is a real challenge, but the main goal is to provide students with concepts and frameworks in anti-racism and social justice so that they can carry into their subsequent research and practice. And again, because this course is required, a lot of students come to YSPH with this interest and with a lot of background, but because this is a required course and everybody's going through it together in their first year, we're sort of, saying, everybody's going to leave the program with this kind of, this kind of background or these tools. So.
Does anybody else want to address this in terms of how we kind of train and mentor our students within this concept?
I'll jump in. Yeah. Okay.
Yep.
So I teach community-based health program evaluation, and so my main focus really is evaluation. And throughout the course, we address different theories, and one being the theory of social equity. But in the course itself, with each case study, we talk about how did or didn't this evaluation address equity? How could they have done it differently? What it wouldn't have required? And so looking at case studies and revising case studies in a way that would really address equity. Also looking at how to do your evaluation. So whether it's analytically, how to look at your results to address health equity and social justice. Also the programming, looking at the programming as an evaluator around social justice issues, and also how to engage community in conducting evaluation. So in the process of developing and conducting an evaluation, what are different techniques and strategies you can use to engage community? So we do those kind of like practical app scenarios, and also looking at for themselves to consider who they are coming into the space as an evaluator. So if they're doing community-based work, how are they showing up? And really thinking themselves about their privilege and any bias, unconscious bias that they have, and how that may be affecting how they do their work. So that's part of the course. And then also we have actually developed this Health Equity Fellows program, which is tied to a internship where it's been in the summer, but we're hoping to do it more broadly throughout the year, in which the students are paired with an organization that's focused on social justice and health equity. And we're supporting that organization as well as that student throughout the internship experience. And the student also meets weekly with the cadre of students and mentors to discuss how they're showing up, unconscious bias, their privilege, how they're seeing racism in the work that they're doing currently, and how it can be addressed. So really having these reflective conversations about the work they're doing while they're doing it with the organization. And so this Health Equity Fellows program is one that we hope to expand. The students, we have gotten feedback from the students. One student said it was the best thing she's ever done. So that was kind of a rave review. But it really provides the students with these opportunities to have some deep reflection and discussions related to this topic while they're doing the real work. So, you know, here in New Haven. So that's an exciting component too, that we piloted it 3 years ago, and this past summer, we had 9 students for the health equity internships. And that's really, it's at 9 because of funding. We want to make sure that we're funding the students to do these internships, because that's also an equity issue. So we find across the school that you know, many students need to get paid to do their internship. They can't necessarily volunteer all summer. And so that becomes an equity issue for students if we're not paying them to you know, do their internship. So so that's a program also that we've established here, also with the Office of Public Health Practice.
And then lastly, I think we can highlight also the new concentration, or newish concentration, on U.S. health justice that we is in its second year officially, but that we started developing almost 4 to 5 years ago, at least in concept. And I remember that it was actually derived from student interest. They were specifically. I remember Roxanne Winston, one of our alumni, at a happy hour said, you know, why is there all these opportunities for global justice, but there's nothing that we can do, kind of focusing on equity in our own backyard, and why don't we have a focus there? And so we've really developed this with the input of students, faculty, and community members, and really developed this robust focus, a concentration on U.S. health justice. I don't know, Don, did you want to quickly summarize it for people if they don't know?
Sure. Yeah, so this concentration, you know, after a few years of in development with a lot of input from students, as Trey said, finally sort of officially launched, and it was accredited and launched last spring. And we have 18 students enrolled in the first cohort, and they span across 5 of the 6 WISE-PH departments. And I think there's been a lot of interest this year, so I expect that second year cohort will be much larger. But the aim of the concentration is to really give students an opportunity to dig into these issues of equity and justice in the way that power and structure constrains health, and also to give them some concrete skills. So one of the things we've done as part of the concentration is to bring in a new faculty, Dr. Takesha Everett, who is the Director of Health Policy Solutions, which is a nonprofit, a Connecticut nonprofit focused on evaluating policy from an equity perspective. And she is teaching a class in advocacy and activism, which students got rave reviews last year. I mean, it was an amazing class. And so that's a requirement as part of the concentration. And then Dr. Opara is going to teach another class for the concentration in CBPR. So to help, foster ways to engage equitably with the community. So yeah, and another part of the concentration is that students do a practicum that is social justice focused, working with, in some cases, a local, but not always local organization. And we've been working with Kathleen and the Office of Public Health Practice and the Health Equity Fellowships to support students in these internships, and to, I met with the students over the summer for informal Zoom lunches that didn't have any food because they were over Zoom, to support them in their internship last summer. So another part is to create a cohort and a community of students who are focusing on health justice in the U.S. So that is concentration in a nutshell.
So thank you. All right, so then we have about 15 more minutes. So so what if we switch to what might be our final question, but what is kind of next, given you guys gave such an amazing overview of the work and what you're thinking about terms of where you see this going and where things currently are from a social justice and health equity perspective, and given your current interest, and you guys kind of touched on some of this, what do you see next on your horizon in terms of what you are working on, and particularly like from an improvement of health equity, not only from an understanding, but like in terms of starting to start to dismantle some of these structural factors that we talked about? Do you guys have anything that's kind of next on your thinking or horizon as you tackle this? Kathleen, can I start with you?
So I would really like to see, and we're talking about this with related centers at YSPH and the Office of Public Health Practice, with CARE, the Prevention Research Center, to have something like a social impact lab where we really bring together these different practice-based initiatives and things like we discussed, the health equity fellowships with students, the training of the community research fellows, the training of the investigators in CB, community-based participatory research approaches, and all matched with work that's going on in the community and identified by the community, and have this synergized in a way that then we can also assess the impact. So working together with all of these different practice centers, working together, and then to assess what we're really doing and what impact we're having in New Haven, and of course with residents. So that's my dream.
Good dream to have. Tanya, do you want to go next?
Sure. Yeah, so I think, one thing from a student perspective and in our lab that we're starting to do more of, and I hope we can expand, is to really build these stronger ties with organizations that are working on housing in New Haven. And we have some good relationships, and it's been really great to be able to I just had yesterday an informal meeting with the director of Columbus House. We meet every once in a while, and in the conversation is sort of like, what do you need from us? Like, what can we do right now? Like that, what could a student help with? And that's led to some really meaningful experiences, useful experiences for what they need, and then meaningful for students because they're useful. And we're really seeing some exciting action and like local housing policy coming from some of those projects. And then I think for my personal research, I'm just really fired up about the law and legal barriers to housing, and some of the new legislative action. Particularly, Connecticut just became one of the first of 3 states to pass a right to counsel in eviction cases. And throughout history, the law has been a real barrier to housing access, and the law has been a way that we can improve housing access. And so this policy is I think an exciting step, and it was exciting to our lab was involved in doing things around the policy and have been in those conversations. So I want to think about like how we can evaluate that rollout, and how concerns about how is it going to be equitably, what does the implementation look like? And so, yeah, I think that's a direction that I'm interested in. And I'm also a dream, Kathleen, since you said your dream, I'm really interested in the law area, medical legal partnership. So the model of having a lawyer embedded in a health clinic as a way to address social determinants of health. And that's proven to be a really effective model. And I think there's only one place in the country so far that has one that's dedicated to housing. And I would love to see.
Where is that?
I think it's at Penn. So yeah, I think it would be really exciting to see the hospital have a lawyer who is there to address housing needs of patients. That would be my dream.
I mean, it's interesting. Like, I think all of you have kind of touched on the importance of kind of not only just doing this important research that you're doing, but how you can then take that and influence real life policy. And I think, Tanya, your example of that, of being intricate into that, and really having that effect on the local level, and then starting to think about how you could have that maybe on the state or national level might be the next step as well, right?
Mm-hmm.
All right, Katie.
Yeah, so I think as Trace mentioned earlier, as health equity researchers, I not only want to understand health equity, I also want to do what I can to address health equity. So I think moving forward, I would like to kind of move in the direction of developing interventions. So one project I'm planning right now is to design online stigma coping interventions that are tailored to address the needs of Black and Latinx people with disabilities, who we know from the literature encountered significant health disparities compared to people with disabilities who are white, and also people of color who do not have disabilities. So the goal is to make these interventions as accessible as possible to as many people with disabilities as possible. They will be delivered online so that we can access a wide range of participants from different geographic locations. And the goal is to really tailor these interventions to address the intertwining experiences of ableism and racism. So I will be also taking a community-based participatory research approach. I will be involving participants who are from the BIPOC disability community to adapt the interventions, to make sure the intervention contents are tailored to address their experiences of intersectional stigma. So that's one project I'm very excited about. Another study, another is more of a broader direction. So I guess that's kind of my dream project, is to make healthcare more accessible and to reduce stigma in healthcare settings. So one possibility is to look at how to reduce mental health and substance use stigma in the context of primary care and also in the context of emergency rooms. Because oftentimes primary care providers and emergency medicine providers are the frontline healthcare workers. They are the people who individuals who are in distress tend to seek out when they first come into the medical system. So to make sure to provide education and training to these providers so that they can treat people with substance use and mental health disorders in a more equitable way, I think will be a great way to make impact and to improve the health outcomes of these populations. Another thing I would potentially like to do is also to provide training education to mental health care providers so that we can create more disability affirmative psychotherapy for people with disabilities. Because I think one issue that I've seen a lot in both the literature and also just from talking to other members of the disability community is that mental health care providers don't have a lot of training in terms of disability competency. They might have had some training in terms of cultural competency, but they really do not know what are some of the common issues facing people with disabilities, and they are not familiar with how to work with people with disabilities in a way that respects our needs, but while also at the same time acknowledging that our mental health concerns are not just are not necessarily as a result of our disabilities. We are still people with a number of different challenges, and it's important for mental health care providers to be able to address that. So I think that's also another dream project of mine, is to disseminate research about disability competency to mental health care providers in order to create more affirmative psychotherapy that's accessible to more people.
And also, another interesting aspect, and like Ijoma mentioned, in terms of there hasn't been much research about, and when we talk about any identity, there hasn't been much research about the diversity within any identity group. So disability has a lot of diversity within that identity that could also have different manifestations of all of these things that you're talking about. So there's so much interesting and important work that could be done within that context. All right, last, Ijoma, you want to talk about your dream? I hope you have a dream project too, because everybody else had a dream project. So you have a project called Dreamers. So
I want to just take over the world. That's what I want to do. So my overall goal as a researcher is to change the deficit narrative that's often placed on Black youth and Hispanic youth as well in urban communities. I want them to see themselves I want them to see themselves as being successful. I want researchers to be able to view Black and Hispanic youth through that lens, to be able to look at them and their families and their communities as communities that can thrive, that are thriving, and their outcomes are mainly due to systemic racism, structural racism, segregation, and we shouldn't focus solely on this individual behavior. And even when we do, given the experiences and the environment that they're forced to be nested in, some of them are still able to thrive. So I want to be able to highlight that in prevention work, and to be able to create sustainable strength-based prevention interventions for specifically catered to Black and Hispanic youth in urban communities. My dream, I have many dreams, but one of my dreams that I'll talk about is I want to be able, I think it's important in order for me to do this work, I can't do it alone. And this is why I value students so much and the training of students, but specifically training students to have this strength-based lens in prevention work. So being able to train doc students, master's students, even undergraduate students, even high school students interested in becoming researchers or interested in the field of research, being able to train them in these specific strategies, specifically students that are from underrepresented backgrounds. I think it's important for them to be reflective in this work in science, so that they could be able to become the next generation of prevention researchers, and then also being able to provide some type of like leadership academy for Black girls too, because my research, what I found is that leadership ability and being able to identify ways to change policy and so forth, like has like a tremendous significant association with low rates of drug use, low rates of engagement in all types of risky behaviors for youth, but this is more specific for Black girls. So being able to create a type of program, whether it's housed at Yale or outside of Yale, for Black girls and other groups as well. That's my like overall goal. One of my many dreams and goals.
These are our short-term goals, right, Trace?
Yeah, well, I mean, that could be, yeah, any and all goal. Well, thank you so much. And then just related to that, so because it kind of reminds me of the concentration with Joan, where you talked about the deficit approach. So part of the concentration thing we're also teaching, public health does have some aspects of the way it studies sometimes that can manifest some of these things, like this individualistic perspective instead of really looking at the structural perspective. And part of our concentration actually does allow really public health to look inward of how we're training, the language we're using in journals that could perpetuating some of this problematic thinking. And so not only are we taking it from like a research perspective, but we really are looking, we're not just looking outward or externally, we're really trying to look inward to make public health kind of a better, more responsive, a less oppressive, less anti-racist place. And so it is something that I think we're trying to integrate not only within the research that we do, but again, in the way we do it and the way we train and lead forward. So with that, I think we've done a pretty good job here as a panel. I want to thank the panel for really sharing their amazing and innovative and important research. It's a pleasure not only being on this panel with you and moderating it, but being colleagues with you all. And we do seem to have a question. We're not done yet. Final question. So with this is from Ruth Tabor. With all the research programs, bottom line, results usually get translated into action since public health doesn't have mass appeal, glamour, understanding in the general public. Dr. Ramon mentioned use of well-known writers for communicating COVID info is a tiny start. Ask average person, what is public health? Answers far removed from your work. Oh, thanks everybody. It was the comment bar. But I don't know if anybody has a reflection of that or any final words.
I have a comment to that. I think that a part of the work that I do as a community-based researcher or just as a public health researcher in general, is to be able to disseminate this work to the public. Writing peer-reviewed articles are great, but most people don't even have access to even read our articles except other researchers. So, and this is not the population that I'm studying. So I want, youth and their families to be able to understand the work that I'm doing, see the implications, provide those implications to policymakers and so forth. So one of the things that we do in my lab is we develop a policy report every year based on our findings, specific to the local community that we're focusing on. For this study, we're focusing on Paterson. And I have a close relationship with the mayor of Paterson and city council. So I provide them with the report. I present it to the school district. I present it to the city council with recommendations on how our work can actually inform policy to protect and benefit youth. Another thing that I do is I disseminate my research findings through social media in the form of infographics. That's been a success because that not only does that provide students that are in my lab the training to be able to dissect the scientific article, but to be able to provide it to the lay audience in words that they'll be able to understand and see the implications of the work that we're doing. So that that's been helpful even for my community partners who have told me like they're able to share it with like their students and youth that they're working with, and it's more digestible as opposed to our conference presentations or research findings and so forth.
Yeah, those are great comments, Choma. And then if anybody wants to follow Choma, she on her Twitter, she would value more followers, right, from your 20,000 followers. All right, so thank you all. This has been a spectacular panel, and you guys really helped illuminate the amazing work that you're doing. So